Hello and welcome to the show. Remember to subscribe once you're done listening to the episode. It's available on Spotify, Google, and Apple Podcasts or any podcast player of your choice. Remember to give me a 5-star review because I'm giving you more value than what you've paid for. Because so far, the podcast is free and you've paid me absolutely nothing. Today on the show, we're going to go back to audience questions. The question from Bernadette Mutsambiwa, or Mutsambiwe, I think. I really should confirm that before I put up the podcast show notes. Okay, so in the last episode, we went into the practical issues of how to go about validating your business idea before you start setting things up. And of course, for Bernadette Mutambiwe, her question is had to do with whether a diagnostics medical. Okay, let me recap. Essentially, in the last episode, what we tackled was this. We started looking into whether a diagnostics medical laboratory, how to figure out if it's a profitable enterprise before you get into the business. Because opening up a medical diagnostics laboratory is going to involve some capital expenditure. You're going to have to buy the building or rent the building. You're going to have to pay for employees. Even if you start it all by yourself, you can't, Bernadette most likely cannot staff it by herself from the beginning all the way through to the end. You know, people to handle payments, people to handle clerical. I think you need at least 2 lab attendants. That's just my guess. Looking at other labs that I've been to so far, I guess you need 2 lab attendants. You need to have a phlebotomist specialist there because it's not the sort of thing that you can do every single thing by yourself. So, if you're in business, you're a caker, you're a wedding photographer, sorry, not caker, what do you call them? Cake maker, baker. You can do everything by yourself. The wedding photographer, you can shoot, you can edit, you can run invoices, you can do all that by yourself. But, excuse me, if you're running a medical diagnostics laboratory, then it's not something you can do all by yourself. So there's also chemicals and reagents for mixing and testing. There's utility costs, storage units. You know, you need to have the fridge where you can store the blood and all that other stuff. So bottom line, for Bernadette Mutsambiwe, we tackled the first half of the question, which was we need to figure out if this is a profitable business venture to get into in the first place before sinking a whole bunch of time and money. Now, in the last episode, we discussed that the first step to validate your business idea is to define the target market, and that's because we need to know exactly who it is we're chasing before we start running after people willy-nilly. It's not going to be advisable for you to start chasing after people only to find out that the people are irrelevant to the business plans that you had and are inconsequential, and the people are never going to buy in the first place. So for the possible target market, off the top of my head, we came up with individuals, hospitals, clinics, and specialized medical centers, which I promise we're going to use as the basis for fleshing out the episodes. And so that's pretty much the same game plan that we're going to do today. The last episode, we looked at individuals, how to figure out who the individuals you should be approaching, and we came up with some plans and talking points about how to go over those sorts of individuals. So if this is your first time of listening to the podcast and you're curious, you want to see how talking to individuals can be used to validate your business idea, to make sure that there's market demand and that there's some promise there before you sink time and money into it, then just listen, skip back one episode once you're done, and you'll get caught up to speed. So in today's episode, we're going to be looking at hospitals, clinics, and specialized medical centers. Now, ideally, if Bernadette Mutsambiwe was a paying client, I guess we would have to come up with individual action plans for each, action plans for hospital and the clinic and specialized medical centers. They would be similar, but kind of separate. So today we're just going to lump everything together. So also in the last episode, I stressed that the reason why we're going to be interacting with these people and these organizations is because we're trying to figure out a couple of things. Number one, we're trying to figure out what their needs are. And that's a good idea because if you know what the needs are, then you can design the best processes around people's needs. It makes the business much more efficient. It makes it easily referable. And then we're also trying to figure out the decision-making process or decision-making criteria. We want to know how people decide to use medical diagnostic services. How do they decide to use one over the other? What are the key things? Things like that. Because it's going to help in the when we start the buying conversations, or rather the selling conversations. We need to be sure that we're talking to the right people. We need to know what is important to them, and that informs how we make our presentation, how we ask them to buy, basically. Now, remember, my assumptions for the last episode and my assumptions for this episode are the same. I'm making some common sense guesses as a layperson, as an ordinary person, because we're talking about medicine here. So actually, we should be looking for the opinion of medically trained personnel. And those are the people who are going to tell us which ideas for promoting the business, which ideas are ethical, which ideas are practical, which ideas are legal, which ideas are cost effective, etc., etc. There's a whole bunch of stuff to decide upon. The example that I gave was in conducting interviews was how you can't talk to children, because from wedding photography, where I started off my experience in entrepreneurship, over to this question that we're tackling now for Bernadette, ethically talking. Okay, it's not just even ethical. I think in this case it's illegal. I can't talk to children as a wedding photographer without their parents being present. And it's, the same thing if we're doing research, a bunch of research to validate the Diagnostics Medical Center. Talking to children, that would be illegal and unethical. So, medical personnel, they'll be able to let us know which methods we're describing here: ethical, practical, legal, or cost effective. So whatever I say here, take with a pinch of salt. Then I also ran over the benefits of all this activity, because it is a whole lot of work. And I'm sure that if you haven't had to do these sorts of activities before, you're listening to this and you're thinking, what the hell? Do I really have to do all this before I start my business? And the truth is, you don't have to do all this, but it will be helpful if you do. And the reason why it's going to be helpful is this. In Bernadette's case, we're going to be talking to tons of individuals. We're going to be talking to different stakeholders. We're going to be talking to different organizations. Now, doing this, we're going to get first-hand information about how to staff the lab, about the services you can offer. It's also going to give you a good sense of where you can, what people find valuable. That will allow you to lean one way or another on pricing. The example that I gave is how I'm tired of 2-hour waits, and I know a bunch of parents in Abuja hospitals who are tired of 2-year waits. Sorry, not 2 years, 2-hour waits, excuse me, just to confirm a malaria diagnosis for kids, and how it might be a market changer if some other person rolls along and they have a 30-minute malaria test. Some parents might be willing to pay for that. Like, okay, there's this test available. The result is in 30 minutes instead of 2 hours, and then pay for that instead. So that's the benefit of all this marketing activity: first-hand information, first-hand insights, first-hand data. And then plus, another thing is, if you start with all this activity, spending days and weeks talking to people, then these classes of people and stakeholders that you're talking to are going to be the first set of people that you talk to when you actually roll out your business plans. So in a way, trying to validate your business idea is also a way of front-loading your sales and front-loading your marketing. Because when the idea is up and running, these are the individuals, the hospital administrators, what have you. They can go back to say, hey, remember me, I'm the chap, I'm the lady who came by your office to discuss blah, 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 and this. Well, all those fancy ideas we spoke about, the ideas are ready, and this is the new address. When will you be ready to run a trial order with us? Something like that. So it's front-loading your marketing activities. So all the people that we're talking to now at this stage of trying to validate the idea are going to become the preliminary leads. There's going to be our first marketing list that we're going to hit up when we open the medical diagnostics laboratory. So today we're going to explore how sales techniques, research techniques, conversation techniques, how they apply when we start talking to hospitals, when we start talking to clinics, when we start talking to specialized medical centers. Remember, the goal is to get data to validate our business idea. We want to know, opening a medical diagnostics lab in our city, in our town, in our local government, in our county, is it a good idea? Is there demand? Is this a business that will grow, or is this a business that is going to flop because nobody can be bothered? So we're trying to discover, is it a good idea to open up a medical diagnostics lab in XYZ location? So today we're going to look at sales techniques, conversation techniques that we can apply for talking to clinics, medical centers, what have you. So what's the action plan for interacting with hospitals, clinics, and specialized medical centers? Well, just like the with individuals yesterday, we have to identify who the key contacts are. Now, the target roles or the key decision makers or the influencers or whatever it is that you want to call them, the orga at the top, the movers and shakers, the whatever it is that you call them in your own part of the world, we need to target those sorts of people within the organizations. So we're thinking of having conversations with hospital administrators, laboratory managers, medical directors, procurement officers. In fact, yeah, we should talk to procurement officers. Those are the people who sign the checks, to pay for stuff. I mean, they're not my favorite people. I don't like dealing with procurement. But hey, we have to talk to procurement people. So this is a lot of work up front. I understand, because if this is your first time getting into business, you probably haven't done this much work for anything before. Yes, it's a lot of work. But consider this. When you set up the laboratory and it's time to start marketing, I know I've said it, but I'm emphasizing it again. Who are the people that you're going to start talking to sell your services? If you're going to be selling to clinics and hospitals and places like that, it is exactly this class of people that I'm talking about. The hospital admin, the lab manager, the medical director, the procurement person, the I think it's lawyers that have practice manager. I'm not sure what you have in the hospital. So it's the same people. So doing all of this activity to validate the idea is making your job of marketing your services in the future a whole lot easier, because you have established a relationship with these people. Let's say it took you 2 months to do your research, and in the 2 months you visited each hospital maybe 2 or 3 times. There's an established relationship. They've seen your face. They know that you're a smart guy. They know that you're a very brilliant girl. And you sound credible, you sound capable. They know what your plans are for the lab. So, of course, now that the lab is live, there's an established relationship. There's an incentive to start having conversations with you, rather than having a conversation to the Johnny Just Come who has opened something up down the block. So you have made progress. Now, when we look for the hospital admin or the lab manager or the medical director or the procurement person or the person who is in charge of overall hospital admin or whatever, what are the conversation points that we are going to have? Now, the conversation points that we're going to be having with these people basically is going to be all around assessing the services. So the questions are, we're trying to figure out the current medical diagnostic services that they use. Now, this is important because when you start operating your own services, this is where you're going to get the information to convince them to switch services. If you uncover pain points, let's say right now with the medical diagnostic services that they use, if they're doing it in-house, or they're outsourcing, but you are able to figure out that they have problems with accuracy, and yes, accuracy is a thing, because I remember a time when I thought I had cancer, and I went to go and use one lab, and test results came in, and of course, as a young man, I just thought, wow, so the thing is malignant. Okay, I guess my life is over. But anyway, multiple tests confirmed the diagnosis, or rather to reconfirm the diagnosis. Turns out that the growth was not malignant. It was benign. We got rid of it anyway. But the point I'm just trying to say is that, accuracy can be an issue with these sorts of things. You go to one lab, you do a test, they say this is the result, and you go to another lab, or you go to 2 or 3 other labs, and then at the end of the day, you find out that the first test that you did was not entirely accurate. So if you're able to uncover pain points around accuracy of the results that they've been getting, delays in workflow, processing time, or maybe even the cost, things like that. If you're able to uncover problems, when you start your own laboratory, then this is how you're going to be able to use it to inform your sales process. You're going to be able to say, hey, Oga lab manager, Madam lab administrator, last time that we spoke, you said you guys have 80% accuracy, blah, blah, blah. But with the new techniques that we have right now when you're looking for cancer, what's it called? Okay, let me just make up a word. So with the latest technology that we have right now in cancer diagnostics, we're able to go from 80% accuracy up to 96% accuracy, blah, blah, blah. So, that's going to be your sales pitch at the time. Now, you're only going to be able to get this information if when you are talking to the lab admin, the hospital admin, general manager or whoever, people that run these hospitals, is if you asked, if you did a services assessment to find out what the problems are that they currently have. Who are they using? How are they running it? Are there any problems? You also need to find out the range of tests that they perform. That gives you a sense of whether there's demand for some stuff or whether some things are even profitable. Whether some things are even profitable or not. For instance, in Nigeria, it looks like, is it kidney? No, not kidney. I think it's kidney. There's a market for medical tourism between Nigeria and India. I think people go there for kidney issues, dialysis, and blah blah blah, and then stuff like that. So if you're thinking of running your medical lab and you want it to specialize in kidney and is it urolysis or urinalysis? Urinalysis issues. Medical doctors, forgive me, please. Remember, I'm a layman. So if you want that to be your specialty, it's from running around and talking to hospital administrators that you're going to get the sense of, oh, there is no demand for this because people seem to think Indians are very good at sorting out cancer and urology issues and stuff like that. You will get a sense of the demand rather than sinking a whole bunch of money and buying all the equipment and then trying to start doing the services here. But it looks like most people, it looks like the general consensus is if it is this kind of medical issue or if it's that kind of medical issue, go to India. For this kind of medical issue, go to Russia. For that kind of medical issue, go to the UK or whatever. So it's nice to receive a heads up before you actually start these sorts of things. And that is why all these conversations with these people are important. And that's how I will let you know whether this is good business to begin or whether it's a bad idea to start it in your own location. Because it might be a bad idea in Nigeria, but if you have the funds and you have contacts, it might be a good idea to start up that business in India. Especially given what the medical tourism trends are right now. Then it's also important to discuss customization and needs, specific tests that these people need or that they would like, but they don't currently have access to. From the birth of my children, both children born in Abuja in Nigeria here, I have seen that when it comes to neonatal services, I know it's not related to laboratory diagnostics. So when it comes to neonatal services, there's a limit to the kinds of services that you can get. So some hospitals would like to offer this, but they don't have access to that. You have to go to National Hospital to get access to National Hospital in Abuja or certain hospitals in Lagos, or fly mommy and baby abroad for access to this and then access to that. So it's important to ask these sorts of questions as well, because sometimes they can give you data on what the hotbeds are. What are people looking forward to, what are hospitals looking forward to, but they can't get, at the moment. So that's also a good idea. Then the action plan for starting this conversation is quite simple. Of course, there's an initial outreach. Sit down and give it a thought, come up with what a good introduction is, for when you meet with these people. And then, of course, when you have these meetings or you make these phone calls or you do the email or whatever, you have to state your intent. People don't like wasting time, especially medical professionals who are really busy. Remember, I told you each time I have to go to the hospital because we think the kids have an ear infection or malaria or something. Basically, I'm there for 4 hours. Sometimes it's the whole day, 6 hours straight. So these people are really, really busy. They have work to get to. They have angry, what are they called? Angry, should I say customers? People who go to hospitals, what are they called? Patients, yes. They have angry patients, and so they don't have time to waste. So state your intent. And of course, in this case, the intent would be something like, you're trying to improve the state of medical diagnostics, or you're trying to enhance, let me see. Okay, you're trying to enhance medical diagnostic services, and then you ask them for permission to talk. So that will be it. Summary. That will be the brief approach. So, hello, my name is Chukudi this, or my name is Chinasa that. Thank you very much for taking the meeting. The reason why I'm here is because I'm thinking of setting up my own lab. The goal is to enhance medical diagnostics services in Abuja. So I hope you don't mind if you have 15 minutes. I have a couple of questions to ask you. Would that be okay? So something like that. I'm sure if I sit down, I can come up with something much better, but you get the whole idea. So sit down, compelling introduction, state your intent, get straight to business, and then have a brief conversation around those issues. Hospital admin, they're busy people. Now, this initial outreach, should it be email? Should it be in person? My honest answer, it depends on what you're comfortable with. Although my recommendation is ultimately we should be aiming for an in-person visit. Ultimately, I think Bernadette or whoever wants to validate this idea should be sitting down in somebody's office, looking right across the hospital administrator and having a frank and candid conversation. So that is my recommendation. Let's not be doing this over WhatsApp, SMS, or whatever. But ultimately, even though we're aiming for an in-person visit, I think it makes sense to use LinkedIn first, do some research, send a personalized request, so you guys have one or two chats or something. Eventually, you guys can migrate to DMs, maybe email or SMS or something before you hook up the meeting in the office. But you get the whole point. So it's not a strict either or. So I'm not saying don't touch direct messages, don't touch SMS, don't touch email. But ultimately, we should have a physical meeting with the person. But then, yes, let's use the website, social media, whatever the resources are. In fact, personal introductions, if you can. A doctor who works in this place or in that place, you can say, oh, I've been thinking of visiting so-and-so hospital. Do you happen to know anybody who works there in the urology department? Can you hook up a meeting? That sort of thing. So, so that's it. You can use LinkedIn for your research. You can use Facebook profile for your research. It's not a bad idea. Then, when we're going to have these conversations with these people, the conversations have to be structured. I would have said structured interview, but I don't want to give you guys the impression that you're going there to go and interview someone. This is meant to be a free-flowing conversation. So, but it has to be structured. What I mean by structured is you should have prepared a set of questions ahead of time. What kind of questions? The questions should be open-ended questions. That is what will allow you to gather the most insights into the current diagnostic practices and their current needs when it comes to diagnostics and running tests and things like that. Now, when I say open-ended, this is what I mean. Open-ended is the opposite of closed-ended. Closed-ended questions are questions that can be answered with either yes or no. Don't ask that kind of question. Because if you ask a question and they say yes, you ask another question, they say yes. Another one, they say no. You leave that meeting with lots of yeses, lots of no's, but you don't know how to make sense of things one way or another. So you should be asking open-ended questions. Well, that's a topic for another podcast episode. But for now, summary. Open-ended questions are any questions that begin with who, why, what, when, how, where, if, because those things get you talking. Now, let me repeat. Who, why, what, when, how, if. You get the point. All those W's and all those hypotheticals. So those are the kind of questions you should be asking, because when you ask open-ended questions like that, who, why, what, when, how, where, when, people start talking extensively. You can ask a who question or a when question and the person just says yes or no. The person actually has to talk. So, for example, if you ask the question, do you outsource your medical diagnostics services in this hospital? The person can answer, the hospital admin can look you straight in the face and say, yes, and then keep quiet, and they're waiting. Can you ask the next question, please? Now, you can see that there's not much information there. But then, if you ask instead, let me see. Okay, so instead of asking, do you outsource your medical diagnostics services in this hospital? The person says yes or no. Why not ask a question like, why would you choose outsourcing blah, blah, blah services instead of doing things in-house? And then you keep quiet. So this is a why question. And it starts a conversation because the person can now look you in the face and then say, well, actually, we used to do things in-house, before, but we changed because... You see, in this case, there's a conversation. You're getting qualitative data that you can use. Or the person can respond and say, well, initially, we outsourced things from 2009 to 2012, but then we had to change course because, and then you get all the juicy stuff. So you can see that the second approach is going to give you more information and it's going to give you a richer context. So do you outsource your diagnostic services? Excuse me. Bad question because it's closed-ended. They will answer either yes or no. But then if you ask, why would you choose outsourcing over doing in-house? It's different. It's going to be a conversation. Now, on site visits, I was going to say let's have a site visit, but I just realized that it might not be possible because of ethical concerns here. And then also some practical concerns, contamination, letting strangers into the lab. But if not, okay, and it might be against best practices. I'm not sure what the guidelines are for those sorts of things. And then also issues with custody, specimen custody. You want to make sure that the chain of custody is unbroken. So if it might be a good idea to ask for a site visit, but then don't be offended if it turns you down, because even as a layman, I'm thinking there's several problems with site visits. Like I said, ethical concerns, contamination of samples, is the chain of custody been broken, things like that. So, but if you can get a site visit for other businesses where that's not a problem, like for instance, if you're trying to validate whether running a poultry is a good idea, a site visit in the poultry, I don't think anybody will have a problem with that. They'll say, yeah, sure, come on down, no problem, but just don't wear high heels because there's going to be lots of chicken poop and blah, blah, blah. So, that's it. So a site visit, you're going to be able to observe the facility, see their workflows, let's see what else. And it gives useful information about how to tailor your services. In this case, if you see how the lab actually is run and their workflow, you're going to know how to tailor it when you open up your own services. Now, after gathering, 26 minutes. Okay, let me bring it to a close. Now, after all these conversations and all this data that we gather, when you're ready to launch the laboratory, when you buy the building or lease the building or whatever, the next step is going to be to come back for a a presentation. And then, of course, the context of the content of the proposal is going to be based on the insights that you've gathered. You're going to be able to highlight how your lab is going to meet their pain points. Remember, I think I said, you're going to be able to find out things that they find value, whether they're trying to achieve cost savings or whether they want efficiency, greater accuracy, whether they want, or maybe even greater storage capacity. Maybe currently right now in their lab, they can only store 20 pints of blood, but since they have maternity section, they would like to store 150 pints of blood or something. Oh, by the way, I'm assuming that the pints of blood is stored in the diagnostics section. If it's not stored in the diagnostics section, then forgive me for making such an error. Like I said, I'm not a doctor. So you come up with all right. Okay, 30 minutes. Okay, let me bring this to a close. Sorry, that was my alarm, just so I know when we are heading over time. Okay, so you make the presentation, but you also keep people in the loop, establish relationships, because we need continuous input. We need to be checking in with people all the time, phone calls, inspections, surveys. You guys can do workshops together. Most important thing is people should be seeing your face, from time to time. When you get the lab up and running, it's not just that the lab is up and running. You made your proposal. They send you a whatever, then they pay money, and then people never see your face again. So keep showing up. And then if you're currently showing up, it also helps you to refine your offerings based on how their needs change. So back to the maternity example, they want to store 150 pints of blood. They can currently store 50. Maybe they outsource it to you because you have space for 150. But if the maternity section expands and now they need to store 300 pints of blood, it would be nice for you to know that ahead of time so you can expand the service agreement, get more space, get more refrigerators, get more whatever. Anyway, so you get the idea. Then during the validation stage and after validation stage, of course, from all the things we're talking about so far, I'm sure you get Bernadette and whoever is listening who wants to validate a similar idea. I'm sure you can see that we're going to have to build relationships. So we should be attending networking events, healthcare events, conferences, workshops, stuff like that. That's where you also run into interesting people to talk to and talk about your wonderful ideas for opening the diagnostic lab. We'll also be looking for collaboration opportunities. Sometimes these opportunities come with training or maybe exchanging services, things like that. Let's see, what else? Is there anything I've missed out? Okay, there's something that I stressed in the last episode I want to stress here as well for those of you who want to open these sorts of businesses. Bernadette, I'm sorry, I'm not sure which country you're from, but I know that in Nigeria sometimes we don't like to play by all the rules. There are highly ethical considerations that we have to that I applied here. I stressed it in the last episode. I'm going to stress that as well. Patient's privacy and confidentiality. When you're having these conversations, you can talk about the insights with other people, but if you speak to a hospital admin and hospital admin is telling you private and confidential stuff about the clinic, you cannot discuss that with your wife, with your husband, with your boyfriend, with your girlfriend, with your investors, with your accountant, with your other stakeholders. No, you can't do that. Patient privacy and confidentiality. And of course, transparency. We have to be transparent what our intentions are. When you're having communications with these people, you need to let them know the reason why I'm here. I want to start up a medical lab. These are the services that I want to offer. I'm just trying to figure out, is this a good idea? Or I'm trying to figure out the problems that you have that we can help you solve when we open up this medical lab. So be very transparent about your goals and your intentions. Nobody likes it when people are being sneaky or being shady. Let everybody know where you're heading at all times. So the key to validating this business idea is just approach all these conversations, whether with individuals or with people within the medical healthcare system. Approach these conversations with genuine interest to understand what people need, and also keeping an eye out for the solutions that you can provide. Then try to build strong relationships so you can tailor the services to meet these demands. Now, I hope I've been able to convince you that you can enhance your likelihood of a successful business if you choose to validate the idea beforehand. The chances of you growing a successful business, I think, go up. And best case scenario, if this is a bad business to get into, from talking to all these people, individuals, and then people working in the healthcare system, you will know for sure that, you know what, on paper it looks like it's a good idea, but because of these issues or those issues, this is a bad idea that we are going a bad idea to start. Now, before I run off, change of plans. I'm going to ignore the other side of the equation, the other side of the question, because it was a two-part. Number one, how do I validate before I start? And then number two, if I've already started, how do I go about advertising and attracting customers? I'm going to ignore the number two part of that question. Because if you've been following last episode and this episode, you can see that some of the things that we've spoken about, especially with approaching here, hospital administrators, lab technicians, the practice administrator, the procurement people, it's the same process that you're going to go through if the lab is already open and you're now trying to get business from other clinics. So you can see that because some of the stuff we have discussed in the last episode and this episode, they apply if you've already rented the building, you've employed your 5 staff, you have your fridge, you have your blood bank, you have your reagents, you have your everything. So some of the same processes apply. So I'm going to ignore the second part of the question. Also because I think we've done total. I think we've done maybe like an hour and a half on this on Bernadette's question. So I will move on to the next audience question because there's still a bunch of you that I haven't gotten back to. So that's it essentially. That's all, folks. So remember, connect with me on WhatsApp or Telegram. The number is 080-6466-2140. The country code is +234 for those of you who are hitting me up outside of Nigeria. And also connect with me on LinkedIn. My name is Tabeshima Ayede. I'm also on other socials, but I spend most of my time on LinkedIn these days. You can confirm the spelling of my name and my email address on the website where you're listening to this episode. Also on the profile of the podcast app where you're currently listening to my voice. So thanks for your time and attention. I'll catch you guys at the next episode.